And we welcome you back on our set. Special guest sitting in with us, a guy that I see a little bit more in the wintertime. Nice to see you out in the summer a little bit. Dr. Matt Roth, Promedica physician, who also is the team doc for the Toledo Walleye. Thanks for coming down.
Hey, thanks for having me.
And we wanted to touch a little bit on, because of the fact there's so many kids now that are playing youth sports. You know, boys, girls, doesn't matter. You're seeing a lot as far as injuries are concerned now, aren't we?
That's correct.
I mean, it's going to happen with sports anyway, but talk a little bit about children that are playing sports and getting injured now.
Yeah, there's about 30 million youth out there playing some sort of organized sports, which is more than we've ever seen. And unfortunately, like you said, we're seeing more injuries too, with over 3.8 million injuries across the U.S.
It's a huge number.
That is. Yeah, what's the most common injury for young kids?
Yeah, it really depends on the sport. Of course, we're going to see all the sprains and strains and all the common things, but we're unfortunately seeing a lot more of the overuse type injuries. So in our baseball players, our shoulder injuries, our elbow injuries, those kind of things. Increased level of competition, increased number of leagues there, and a lot of these kids are playing one sport year-round all the time.
You know, and it's one thing that has changed a little bit, Doc. I think that when Jim Weber played sports, you and I played sports as kids. I mean, you played everything.
Yeah.
You went and played, okay, it's football season, so I'm playing football.
Right.
Okay, it's, you know, basketball season or it's hockey season, I'm playing that. Summertime, I'm playing baseball. Now, you're getting so many kids that are specialized. Is that something that is causing maybe some of this?
It is, especially as that level of competition now is kicking up. Right when that skeleton is growing the most it is, the bones and the tendons aren't keeping up with all the extra wear and tear on it. So yeah, we are seeing a lot more of that. And putting different stressors, you know, going from football to a hockey to a track or something like that, mixing up the different kinds of stressors, you know, doesn't stress that same point over and over and over again.
And I think that's part of, Jim, what they've been talking about a lot with, we've seen so many Tommy John injuries for baseball pitchers and even players now. I mean, you know, we had a couple of even catchers that have gone down now for Tommy John injury, and that's kind of the same thing. They're all coming up now. All they do is, if you're a pitcher, you're pitching, right?
Right.
I wanted to ask the doctor also, like, what should a parent or a guardian do if they think their child has had a sports injury? What should they do right away?
Yeah, so I mean, obviously if it's one of those acute injuries, something's broken, you want to get the appropriate acute care. Someplace like Promedica, Toledo Children's Hospital, someplace that's dedicated to being familiar with those sports injuries, particularly in our youth population. If it's more of the chronic overuse, you know, those pains that just aren't going away, they can start off with their primary care physician, their pediatrician, their family practice doctor, but oftentimes, you know, seeing a sports medicine specialist to get them back in the quickest and safest way possible.
Well, appreciate it very much, Doc. Thanks for coming
Thanks for having
me. Dr. Matt Roth joining us here on Around the Bases.